Dentistry has come a long way since we were kids. Today, there are specialists specifically trained to be pediatric dentists, so our kids don't have to have the kind of traumatic experiences that we had with dentists when we were kids. Galactic Smiles is a pediatric dental office that cares about your children's oral health care. Our ultimate goal is the well-being of your child, and all of our services are provided according to AAPD guidelines. For example, when bacteria start attacking and causing decay in between two back molars, usually caused by irregular or lack of flossing, it's only detectable with X-rays, unless it is very extensive and deep. Not all kids are comfortable with bite wings, the back teeth X-rays that show cavities in between baby molars, especially kids under 5 or those who are very anxious. In these cases, we only take the X-rays when the patient feels comfortable with them. If the patient needs treatment, then the bite wings will be taken the day of sedation treatment or when they're more cooperative in future visits. When bite wings were taken and decay was found, the two treatment alternatives the doctor has are 1. A filling, or 2. A stainless steel crown. The choice depends on the amount of decay noted in your child's mouth and the risk level your child is. The AAPD lists 3 risk levels: low, moderate, and high, each one of them with their own characteristics, such as total noted decay, how extensive it is, diet, oral hygiene, and genetics, among others. When bacteria reaches the junction between the enamel and dentin, and the patient won't have the molars for more than a couple of years, we consider placing a filling, since it can last until the permanent teeth replace them. It's important to note that crowns can also be considered when the patient has multiple lesions of this type reaching the enamel and dentin junction. If flossing and diet aren't improved and more decay happens, we need to place a crown until permanent teeth take over. When bacteria reaches beyond the junction between enamel and dentin and the molars will be in the patient's mouth for longer, we then consider a crown. Crowns are more durable because they cover more area and they're made of metal, but there are tooth-colored molars too. This is a great option for teeth with decay on 2 or more surfaces, and they're more resistant to decay than a filling. How long the crowns last depends on oral care at home, including diet, brushing, and flossing. Crowns can be uncomfortable at first, but it doesn't take long before they feel normal. Whether your child needs a filling, a crown, or just a good cleaning, Galactic Smiles goes the extra mile to make sure they're comfortable and happy when they visit us and when they leave. Contact us today to learn more or to set an appointment.